Here we go. Perfect. We will be getting started here. Welcome to really our first virtual coffee since AEP has been done. I know you guys are probably recovering from the last couple of weeks, but we got a fair bit to cover today. Probably going to keep it down to about 30 minutes or so to give you guys some time back. But of course, this will be recorded and, as usual, uploaded onto our agent portal. And obviously, we're back at 9 a.m. So thank you so much for taking the time out of your Friday. We're a couple of weeks away from the holidays. And just to give you a bit of an update, I will be doing today and next Friday, the 22nd. We'll be doing a virtual coffee and keeping them fairly short. And then on the 29th, we will not be doing one and then resuming in 2024. So, excuse me, that's what we're going to be doing over the next few weeks. So this week and next week, we will definitely be having our little calls here. And we're going to be covering some of those topics you're probably seeing out there in our on our social media and some other stuff out there as well. Lots going on in our industry, although AEP is done. So let's look at our agenda here before we get started. Judy is unfortunately not able to join us today. She's at her annual BOIC Insurance Group meetings and planning for 2024. So she's got a lot going on this week. So I spoke to her earlier today. Great spirit. She wishes everybody the best, and she'll be back next week. And we'll be going through some of her wins and things that she's seen from the last 7 or 8 weeks. We'll be talking today just on a few AMA updates. The main topic today is going to be talking about some of those compliance updates as well. So through the last 7 or 8 weeks, I've personally been involved in a number of compliance questions, issues, that type of thing. So we're going to talk about the PECL, or the pre-enrollment checklist, the needs, the new needs assessment as well with the checklist. And then we'll be talking a little bit about the Medicare Center and some of the signing opportunities and what you should be doing and looking for on that today. And then we'll be looking at some of the carrier updates, and that's going to kind of finish us today. So we're going to be looking at about a 30-minute call today, as well as ever. If you do have questions, please put your questions into the Q&A and we'll endeavor to answer those. And of course, the chat room is there for you to utilize as well. Once you put a message in there, it is able to be seen by any participants, and of course use that for yourselves. Yeah, this is for you. This is why we have that webinar chat. We have it for you to utilize, to talk to your colleagues, friends, and share ideas, etc. as well. Okay, full disclosure, I'm actually in Europe at the moment, so this is actually 5 p.m. in the evening on Friday, and that's where I'll be for the next couple of weeks. I'll still be working, doing some stuff, but also trying to take a bit of time out to spend with my family out here in the UK. So please feel free. Text or email is still fine. If it takes me a little bit longer to get back to you, you will know why. But thank you again for joining us on this wonderful Friday. So first of all, I want to say a huge thank you to all of our AMA agencies, all of our agents, and all of our staff members as well, who were there for probably one of the most difficult AEPs that I have seen. There was a lot going on, a lot of information. There was a heck of a lot of things that changed. There was disruption in a lot of our marketplaces. Carriers leaving, medical groups leaving, new plans, new carriers, new medical groups, lots of disruption. It was one of those AEPs that I know a lot of you did a lot of work and put a lot of time into. And of course, now is the time to start thinking about those results, sharing those results with each other as well. But a huge thank you. Well done. You all put so much effort, hard work in. I was so proud to see a lot of you during AEP and talk to a lot of you who had record breaking years. And those of you that didn't, you guys still put that effort in. You still were there day in, day out. And I think now is the time to reflect on that. But we'll talk about that in a moment. What I would like to add to this is if any of you did any of the events that were involved, Optum, Archwell, Centerwell, WellCare, Scan, any of those events that we did utilizing educational events, please make sure the feedback forms that we did use and shared with you have been completed. I do have to provide that feedback to our partner carriers, etc., to help out. So really important if we can make sure that you guys are completing that, because this is going to be based on how we did, whether we get some of this co-op help, whether we get any support from our carrier partners, our medical group partners as well. I know some of you are already having those conversations for Q1, and quite rightly. But again, we do need to feedback that information for December and November, and really the AEP period. So if you were involved, if you don't know what the feedback forms are for these, please reach out to Eve Valdez. She is our she was looking after this feedback forms, and she'll be sending those out today. So now what next? Hopefully some of you have taken time to relax a little bit, get over AEP, but now is the time to kind of think about and review what happened during those 7 or 8 weeks. A lot of things worked great this year. A lot of things were a little different. Some things didn't work. So what worked? Why did it work? What didn't work? And why did you think that didn't work as well? And more importantly, make some notes. What would you do differently next year? What will you continue to do? And really, this is for your AEP. Just take a little bit of time, whether you want to do this electronically, or you can do this on a little pad or notebook or whatever you decide, a calendar even. Get this information down, because you'll forget it very, very soon. Trust me, you'll get into the holidays. We'll get into January the 1st, jump right into OEP. And before we know it, you'll forget what worked, what didn't work, what things are going to happen for next year, and what you want to do next year and plan for next year. Just jot down some things. It has to be, it can be very simple. And obviously, we'll be working on helping you with certain things throughout the year to help grow your business. Disruption equals opportunity. I've been talking about that for many, many weeks now. And I think what we did see was the areas with the biggest disruption gave us the most enrollments. So it did give us and create that opportunity. And I think that's a real strong message to take away. There's going to be more disruption over the next year. We've seen things, we've heard about things on social media, on LinkedIn especially, with what potentially is going to happen over the next year. But this disruption will create opportunity. And I saw that the areas that had that did deliver the most enrollments and deliver you the most opportunities as well. That's going to continue this next year. So just take a note now of what really you would like to continue doing for next AEP, what you want to change. I know some of you did meetings. Did they work? How did they work? Did you do your own marketing? Why not? What marketing did you do that worked? What didn't work? How can you be doing that different? And of course, so what now? I know many of you, we're going to take that break, and a well-earned break over the next couple of weeks. There are still SEP opportunities. You've probably seen in California in particular, as many weather-related California local opportunities that is given as an SEP. You've probably seen some of the carriers emailing out already stating, hey, you can still enroll these folks into these plans. And again, you've probably seen that over the last few days. So not only do we have that opportunity to enroll those folks that did have the retention, or sorry, did have the disruption, And don't forget, if a plan or carrier left the county, then you do have till February the 28th to enroll them into a new plan. Obviously, we want to make sure they're taken care of, ready for January the 1st, because if you enroll them between now and December 31st, they're going to be effective for January the 1st. So, you know, there are some opportunities for you to write business if you want to. Obviously, we've got those T65 folk as well. But don't forget, if somebody's dual eligible, the standard dual eligible SEP is not available until January the 1st. They had to abide by the rules of AEP until the end of this year. But of course, if a plan is leaving the county, then it does give them that extra SEP as well. Think about retention. So what should you start thinking about now? Maybe some thank you cards. You probably by now worked out who are all your new clients, who are all of your new and existing clients that you kept. Maybe send out a thank you card to all of those folks. It's a great time to do it. We even have holiday cards and retention cards ready for you. I know some of our agents were actually ordering some of these a few weeks ago to make sure they got them. But if you go onto the Berwick portal, there is a retention catalog, and that does list all of those cards, all of those retention holiday cards, etc., that you can send out. Put some business cards in there. And again, think about how you can get into 2024 and leverage your referral opportunities with these clients. Think about who you can help, how you can help them. We have lots of tools for you to be able to use. So yes, this is the time to take a break, but also it's a time to start thinking. I'm certainly planning and thinking while I'm away about 2024 and how we can be better for all of you and how we can plan our training around that as well for the next year. Okay, some compliance information I want to share with you, and this is on the back of some allegations that we've had, some clients reaching out saying they didn't realize they changed plan, etc., and just some information that I've deemed from the last few weeks on the road there. So first of all, the CMS pre-enrollment checklist. So it's really important before a client makes an enrollment decision, it's important that they understand the benefits and rules. So understanding the benefits, the evidence of coverage provides a complete list of all coverage and services. It's important to review the plan coverage, costs and benefits before they enroll. And again, this tells them to visit the plan website or call the plan number to view a copy of the EOC. Obviously, reviewing the provider directory or the pharmacy directory is going to make sure those two things that we normally get complaints about are things that we cover. And that is your doctor in network, and of course the provider directory, either the online or the listed one, or the pharmacy directory as well, and making sure the formulary is going to cover your drugs or your client's drugs as well. Also, some important rules around that. In addition to their premium, they're going to continue to pay their Part B, etc., etc. And this is just a list of things that are on the pre-enrollment checklist. And don't forget, this year, this is something that we should have all filled out, particularly for those clients that are online. Benefits, premiums, co-payments, co-insurance, what's going to change on January the 1st. Any clients you talk to, all this information is going to be listed in the pre-enrollment checklist, okay? And of course, then for plans that we do not offer in our coverage area, except in emergency or urgent situations, we do not cover services by out-of-network providers, etc. And that's just some of the things that are in the pre-enrollment checklist. It also talks around PPO plans, private fee-for-services, and other plans that do offer out-of-network coverage. And of course, there's a number of counties that have got brand new PPO plans into this year by multiple carriers as well. And again, we have to make sure we explain the effect of going in and out of network. And of course, these plans, as we know, if you go out of network, it's going to change their maximum out of pocket, because once you see an out of network provider, it's going to make sure that it's going to change that maximum out of pocket for our clients from the lower in network out of pocket to the maximum more out of network maximum out of pocket as well. So what's that going to affect on their current coverage as well? So if they're changing from a Med Sup to an MA plan, or they've got TRICARE or one of those plans, how is it going to change? All these things are on that pre-enrollment checklist as well. Also, the chronic special needs plans and dual special needs plans, it talks about how these may change from you going fee for service or you going from a standard plan to a new plan. And of course, this is all things that we've got to talk to our clients about as well. And again, one of the things that I've been asked is, so where do I find the located cheat sheet? So where are all of these pre-enrollment checklists? And of course, each of the carriers generally is calling it mainly the pre-enrollment checklist, or PECL. And if you look on where to find it, most of the carriers have it right at the front, in front of the summary of benefits. If you're not sure, take a photo of this screen. You can then always check alignment just before the summary of benefits as well. And of course, if you go down for Blue Shield, slightly different. It's on the enrollment kit as well. Where can they find it? Log into the producer connection, go to the drop down, click enrollment materials, and it should be on there as well. With some of our other carriers, of course, they're right in the enrollment application form. Cigna, that's actually a standalone document for those that are sending Cigna in Nevada. And then as you move down here, you can see where they're slightly different. So take a photo of this. You want to make sure you know where that is. Most of our carriers have them in an easy place in the enrollment kits as well. But the pre-enrollment checklist is something that was brought in as mandatory for 2024. Also wanted to talk about the needs assessment worksheet and sales presentation. So this is the checklist as well as the needs assessment. This is something that we've had on our agent portal, on AMA's agent portal for the entirety of AEP. This was the updated needs assessment. Again, it's fillable. You can utilize the pre-appointment, which provides you all of that information and insights into your client's needs, so you can actually check on this before you have the sales event or presentation with that client. As you can see, lots of great information on that needs assessment. It is updated for us. And again, you've got your current plan on there, all of those same questions: specialist, primary care physician, preferred hospital, that type of thing as well. Medications. And then if they needed any durable medical equipment, therapy, or any additional benefits they were looking at. So this is the first part of that needs assessment. The second part was the 2024 plan year sales presentation checklist. So this is something that's going to keep you compliant going forward. So some of the things on here I just want to cover: review the kind of health plan the beneficiary desires to enroll in. And of course, some of this information is on that pre-enrollment checklist. Check to see whether the PCP and specialists are in network. And if you fill this out for every client, it then helps you. So if there's a client forgets something, and that's normally what happens when they put an allegation in, they were like, I didn't know I was changing plan. But if you can imagine, you've got both of this document, both the sales presentation checklist and the needs assessment, that's going to help you to answer any allegations that you may have as well. And of course, it goes into, does the beneficiary require dental, vision, hearing, that type of stuff? Do they have any healthcare needs? What's their preferred hospital, other facilities? And of course, you check this off as you answer those questions, and then you can answer these questions and put the detail on that needs assessment. So you've got all the other healthcare needs on here, all that information that we spoke about just now. So this is where you would use those together, check those off, and then answer those questions right into the needs assessment. And of course, explain the potential effect that enrolling will have on your other coverage. We know that if you enroll somebody on a Medicare Advantage plan, it's going to automatically disenroll them from a prescription drug plan or another Medicare Advantage plan. This is just some of the things that really is a reminder for you. I know most of you probably do this well. Most of you check off this in your head, but having this just as an extra fail safe, as an extra opportunity to you to kind of cover yourself and make sure you're asking the right questions of the client, particularly around the 2024 changes, the CMF changes and rules that came in as well. And then the last thing on compliance I want to mention really is around the Medicare Center. So we've chosen the 3 different options of enrolling our clients here just to go through on the Medicare Center. So we're going to start off with the actual Medicare Center. You can actually have a client where you add them into your client list, which is your CRM, and then you can actually enroll them using the Medicare Center and going through that part of it as well. There's 2 options on this, and this is if you're remote, you would send them the enrollment link. So really, where it says agent to complete the enrollment form themselves, that should only be used face-to-face, where you are there with the client and they're face-to-face. If you're remote, you should absolutely be sending the enrollment link for the client to sign off on that as well, and that's on the Medicare Center. If you look on the Medicare app, and that's Connecture, you've got the 2 options again: send to the beneficiary to sign and submit. This should be used again if you're remote. So if you're remote, you should not be completing and submitting the form yourself. The only way that really that's viable if you're remote is if you happen to have a paper application that you took, and then you're filling this out when you get back into your office. And of course, at that stage, you can actually upload that whole document that you have, and it will back up the fact that completing and submitting that form for yourself. But essentially, anyone remote, you should absolutely be sending to the beneficiary. Medicare link. So we got Connect Your Medicare app. And then on the Medicare link, that is our Sunfire. So some of you use Sunfire. If you're using Sunfire, you've got the signature preference. You've got, again, text message, email, e-signature. That is all for the remote. The signature pad is for the face-to-face. So depending on how you're completing that and who you're with, it's going to either be, is the person there face-to-face? Yep, great, I can use the pad. If they're not, then you've got one of those 3 options where you would email them or do their e-signature or text message as well. These are all options with all of the 3 parts of the Medicare Center. And again, I had some good conversations with a number of you agents out there, but also Anne McGlamery, who's the compliance officer, as we know, for Berwick, very well respected through integrity, and lots of good information I got from her as well. And wanted to share some of that with you today, because now we got to think, yes, AEP is over. Look at your compliance. Are you keeping all your records? Are you doing everything you should, particularly around some of the changing with the wording and some of the changing with things that went on for the 2024 final rule as well. Just want to mention something on 2025 final rule. You've probably seen a lot of information come out over the last 2 weeks. You probably heard a lot of noise. You've probably seen articles from many different sources on Facebook, on LinkedIn especially, maybe on Instagram as well. A lot of people are talking about the 2025 proposed rules. There are about 12 items on that, including agent compensation. There's a lot of speculation about FMOs going away and what you're going to do with this and how's this going to work. It's all speculation at the moment. We are waiting to hear an official, some official information from Integrity through Berwick. And of course, next week, Judy and I will be covering those 12 points, what they mean to you as well on our call. So you don't want to miss that next week. It's all going to be about the 2025 proposed rules. And again, places like the National Association of Health Underwriters, or as they used to be called now, NABIB, they're doing some webinars over the coming weeks. I know some of the local chapters are doing them as well. If you want to listen into them and you're not sure, reach out. Most of those are being fed into LinkedIn. And of course, you can listen to those as they occur. Okay, let's just look at some questions here as well. And thank you for all your wonderful comments to me on my little vacation here in the UK. Okay, so let's go through some of those questions. Medicare Supplement Part D client called this agent to tell her that somebody other than her enrolled her into the AARP MAPD effective 1/1/2024. She found out and called AARP to cancel. She then called, obviously, this agent. The cancellation of MAPD will re-enroll her into original Medicare, and that's quite right. But she will not have a Part D plan. But what you can do is you can use the SEP that I mentioned with the carriers to enroll in a Part D plan as well. And of course, we do still have the underwriting holiday until the end of December if she wants to go back into a Medicare supplement plan. So that's the answer to that question as well. So you will be able to use the SEP that we have coming up for the prescription drug plan as well. Okay. She's saying the med sub is still active, so that's fine, but she's going to need the SEP for the Part D plan, which you have the weather-related SEP with those carriers that we mentioned. And I'll be showing you some of those carriers information that sent that out in a little while as well. So how will TRICARE be affected if they enroll into an MA plan? You know, there's a lot of questions about TRICARE, et cetera, et cetera. What I would say is one of these plans, particularly with TRICARE, that includes prescription drugs, what you're going to want to do is enroll them into a plan is an MA only plan. Because if you start messing around with a plan with prescription drugs, it's going to potentially disenroll them from that prescription drug plan. So if it's an MA only plan, it's not going to disenroll them from their TRICARE with prescription drugs that they get. So that's why you're going to want to make sure if you do enroll somebody into an MA plan, it's an MA only plan with TRICARE. And again, similar to VA coverage, but slightly different. If they have VA coverage, normally they get their drugs through VA at no cost. They're probably going to want to make sure they enroll into that MA only plan as well. Okay. Next question. Did I say that consumers that move from MedSup to MAPD will automatically be disenrolled from the prescription drug plan? Yes, I did. So anything with a drug plan disenrolls them from that drug plan. Anything with an MA disenrolls them from an MA. What it doesn't do, it doesn't disenroll them from the Medicare supplement plan. So you must, once it's been approved, then disenroll them from the supplement plan so they're not paying the supplement plan at the same time as a Medicare Advantage plan as well. Yes, the FEMA SEP always applies to prescription drug plans as well as Medicare Advantage. Don't forget, Medicare supplement isn't affected by anything that CMS brings in. And that's the same with anything. PDPs, MAs are always those plans that are affected by any decisions that CMS makes, but not Medicare supplement. Thank you for those questions. Okay, let's look at some of the carrier updates. As you probably saw, Intermountain Health here had a hugely successful AP. Just wanted to say, they wanted to say thank you to all of the agents that helped them. They do have a survey as well and a medical assistant training program, which they're bringing in. So they have sent that out. So if you want to participate in that survey, please do. United Healthcare is bringing out some dual special needs plans, highlights, and some training on the back of that as well. And again, you can see all that information there. And as you probably may have seen, Amazon is now fulfilling the OTC supplies for non-special needs plans in 2024. So UHG, as we know, is one of the largest carriers, and it says here, leading the industry here. But now they're going to be utilizing Amazon to fulfill OTC supplies, but of course, not for those D-SNP and C-SNP plans. WellCare bringing in a lot of new trainings into Nevada here, as you can see, over the next few weeks. We've got the Tuesday, the December 20th. Again, that's a retention or a 30, 60, 90-day book of business retention training. So if you need some help, this is where some of the carriers are really going to bring in some nice stuff for you as well. And that's what they're going to be doing this Tuesday. Again, click to join 9 till 10 a.m. And of course, that's with your broker team, Jennifer and Greg. And of course, many of us know Michael or Mike out there, Mike Haran out there for WellCare as well. Okay, into California here. Just want to let you know that the Medicare Supplement Open Enrollment Bonus Program is going to continue through the 1st of July for Anthem. Also, Anthem want to announce that Dollar General is now their grocery in-network for their grocery network. Lots of locations. So you can see some of these other places where you can use that spend card in with these carriers to go and get those grocery benefits as well. And of course, now let's make sure you connect your new Medicare Advantage members to the support they need while earning extra cash. So of course, you've got HRAs, particularly around those D-SNP plans and non-D-SNP plans. Many of our carriers are utilizing that to offer all of us this extra compensation. For the time being, we're going to continue doing this. So don't worry about what's happening, what you've heard, etc., with the new rules or the new proposed rules, because that's not going to come in for the next 10 months. But of course, we'll update you. We'll make sure you get all of that right information as it appears as well. And of course, just going through again what you can earn on that supplement bonus. SEP opportunities. So of course, Anthem's one of those carriers that are offering the SEP due to fires, drought, winds, storms, etc. There's many of these listed, and this is a good Q&A for Medicare beneficiaries. I missed my opportunity to enroll because of a disaster. Can I have more time to choose my health or prescription drug coverage? And of course, that's the answer that you should be giving. Lots of great information. If I need additional help, where can I go? Of course, you've got 1-800-Medicare as well, or you've got your agent that can answer your question. Qualification for special enrollment and the proof as well. So you can read all of that. That's available for you. And of course, what's going to happen to my enrollment request if it was affected by a disaster and was unable to make a change. If I call 1-800-Medicare or plan an enrollment request after the end of fall open, when will my coverage start? So a lot of this information is good information. Make sure you're up to date. You should have received all of these emails already. I'm just going over them. Blue Shield of California, what are they doing? They're talking really about their gratitude for their support or the support that our agents showed them as well. And again, they've got some great articles about their new HRA program, commission updates, helping clients with their new plans, and also the last chance for the underwriting holiday that I mentioned as well, and tools and hints and tips. And of course, you've got all that information, who to call, how to get in contact with Blue Shield of California. And that's what a lot of the carriers are doing as well, letting you know what's available, what isn't available. Here you've got those supplement bonus program carrying on as well. Okay, as we mentioned, the underwriting holiday, no exceptions, ends December 31st. This will be it for a January 1st effective date as well. And Blue Shield, one of the last carriers to bring out the HRAs, did bring them out, particularly for their D-SNPs. I've got those available as well. Brand new day, Central Health also have increased their HRA to $100, submitted for 12/1 and 1/1 enrollment dates. So again, you can add another $100 to that average transaction value for all of those clients you sign up this month. LA Care are doing a lot of agent training. If you weren't able to go on some of the LA Care 2024 training, or you were too busy, now's the time to do that. Their enrollment tools, brand new enrollment tool, their broker portal, marketing portal, they've got that coming up over the next week on Monday, Wednesday, and Thursday, the 4th of January. Some, great opportunities to join that. They've got early morning, lunchtime, and also the late shift there as well, if you want to join that for LA Care as well. And of course, they're talking about the some of the SCPs that are available. Of course, in LA County, you've got the 10 freeway fire enclosure. Yes, that, believe it or not, is giving an SCP as well. And of course, just make sure with each carrier utilizing that correct reason code for that SCP and make sure it's relevant in the county you're in. Melina, again, talking about wildfire, tropical storms, all of those stuff in California, lots of different opportunities to continue doing enrollments for the end of the year as well. And think about it, those places that have had the disruption, carriers leaving, they are certainly going to need that extra help. We're already seeing that clients are needing or haven't read the letters that have been sent or haven't had the help as well. And of course, this is United Healthcare, always a good one. You can actually visit Jarvis and list all of the nationwide SCPs that are available. But of course, United is always that kind of outlier where once you see United Healthcare moved and done something, it's pretty good and it's going to happen. This time we've seen 4 or 5 carriers mention those SCP opportunities as well. Okay, and of course there as well, it does list the specific ones that I mentioned for our state of California. WellCare in California, lots of product deep dives, as you can see, over the next few weeks. Next Tuesday, you've got Selling the Dual Market, IE in Imperial County, deep dive. You've got product deep dive, retention best practices, lots of great training. At the end of the day, even if you don't sell a ton of WellCare, having you engaged on these calls, that's what they want. They want to have agents that look at their products and are able to sell their product. This might be an opportunity for you, and I don't think WellCare are going to go anywhere. If anything, they'll be stronger next year. And to be honest, keep your eyes open, keep your mind open for different things that's happening in your local area. Okay, and then general carrier updates. Obviously, alignment, we're talking about the specialty enrollment still. They're continuing doing that, as you can see. It's in other states as well, so check out where you work, where you live. If you do enrollments in other states, they may be there as well. Now we're going to come on to Walmart. Staffing starts on January the 2nd. If you need to change your schedule, you can, but you'll need to work with other agents of the store. So if you haven't already, reach out to the agents that were in that store from maybe the other carrier or other FMO. We will endeavor to have all of you that want to participate in Walmart participating. Once you finalize your schedule, please communicate it with Walmart using the Plan Enroll Scheduler button here. And again, staffing requirements, a minimum of 10 hours a week. That's it. So if you're doing a Walmart or you signed up to do one in AEP, really this next 3 months could be that opportunity for you. If you have those in the right place and you're going after the right clients, wanting to help them, wanting to serve them and answer all those questions, I think you'll have that great opportunity as well. It says about not having different agents. If you were in a store and you're not able to staff it and you want to offer that out, let me know. Let's see if we can get over the line with this time, because you do have those real opportunities to, again, work with those clients and, it gets you in front of people. That's the beauty about Walmart. It does get you in front of people. So you can reach out, let me know if you're interested in that. And if you're already doing a store, then continue through that scheduler program as well. There's a brand new Medicare with Confidence. Educational materials are all out there in English through a guide and PowerPoint and Spanish. It's all on our portal. And of course, if you want to email marketing@Berwick Insurance, you can actually have your very own version of this as well, with the correct disclaimers, and who's got all of your information on this. That's the brand new Medicare with Confidence guide, all available for you as well. Some information on Devoted Health, why, and another reason to sell Devoted. And again, as I said, these are moving to the west of the region, And of course, they've got a ton of social media posts. So if you're selling out there in Florida or some of those other counties, maybe in Texas where Devoted is, you have that opportunity to offer a number of these products if you are selling Devoted as well. Humana, you know, again, they're talking about catching your breath. They're talking about tracking your enrollments. Make sure you check those enrollments. Make sure you're going to get paid for all of them in AEP. And you can check that through the carrier portal. Obviously, the Medicare Center through the Medicare agency dashboard or Agent Way, if you're an individual agent, you can actually see what's been reported on your behalf for enrollments through that Agent Way. If it looks wrong, go and find those enrollments. We've got a few enrollment packs on our tray here in our in tray, but also, you know, what I what I would say is just make sure all of your clients that you did sign up for AEP, you're going to be getting paid for over the coming weeks here as well. Lots of upcoming trainings from Humana as well. And of course, the commission details for 2024 will be out very, very soon. Okay, they are also offering through Go65 some marketing resource center credits as well. They're going to select 20 random agents who complete a 5-minute survey, and they're going to get $100 for the marketing resource center, and that's to use on any of those flyers, mailers, any of those items that you would like to purchase through the marketing resource center. Lots of great stuff happening. We talked about the original cost share update, I think last time we were on here. And of course, Select Health. If you want another reason to sell, Select Health in Nevada is the only 5-star plan. You can sell that 5-star plan for next year. So that's a really nice opportunity. From December the 8th, from today, you can sell using the 5-star plan SEP, folks, for Select Health. What I would suggest, if you're not contracted, get contracted with Select Health, get in touch with Lisa Perry there. Talks through as well about the opportunity agent record form if you are utilizing that for your Medicare individual under 65 or small group as well. They've got some documentation there to utilize for that as well. Okay. And then again, looking at the resources on the United Healthcare Medicare Passport. One of the reasons to use United is their passport. That's where you can go off into a different county in different state and potentially use those same benefits as you would in your home county. If you don't know about that program, it's all on the Learning Lag. And again, WellCare, of course, they want to talk about the variety of their products in certain markets as well, and some of those push plans. So lots of training coming out from the carriers, lots of thought process around OEP as well. There's also a communication survey that was sent out. The deadline is going to be today. So don't forget, if you haven't done it, get that out straight away as well. And of course, WellCare have also partnered with the American Legion. So if you're interested in this program, or you have a military background, or you want to participate, please reach out to one of your local reps who will be able to help you as well, or the community relations specialists. So they're the ones that are here to help you find opportunities in your community. That's what they do. If you're not sure what they are or who they are, reach out to your broker manager. I'm sure they will bring them in the conversation for you as well. And they're there to help you increase your sales and help with your goals and make you successful. And then this just talks through how an event should be categorized, how it should be reported through that life cycle as well, through the community specialist, and what your responsibilities are. So maybe if you're interested in this, or you do a lot of events, talk to WellCare. And of course, even further here, these are the national partnership opportunities. This is in addition. So if you want to represent WellCare at one of these events, then these are some of the national partnerships that they have already. Speak to that community relations support person who can get you in front of some of these places as well. Okay, and then just talks through the partnership expectations and what you've got to report there as well. You know, as I mentioned here, This was going to talk through the event leads, etc., and how you're going to do that. Okay, that's really kind of it for today. Want to run through the last couple of questions that is coming up here. It's listing the carriers that are honoring the FEMA SEP. As you saw, we ran through about 5 or 6 already today. So pretty much most of the carriers in California are honoring that, including United, Molina, Alignment, Brand New Day, WellCare. All of those carriers are going to be doing it. Scan as well. So really, as you can see, if in doubt, just call the broker manager for those carriers and you'll be able to check who is doing that as well. There we go. You enrolled a member into MAPD 12.1, member died in December. Do I call the carrier? Yeah, you know, at the end of the day, it's a nice thing to do. If you know that person passed away, please make sure you can do that. Absolutely, just part of the service we should be doing. Normally, it's us that get informed by the carrier when they find out, because quite often when they have mail sent, a family member will be the one to do that. Again, what I would do is I would make sure that family member who contacted you to tell you that your client passed away would like you to inform the carrier that the client passed away. That's what I would do if that was me there as well. Okay, folks, I said to give you some time back. Thank you so much for joining us today. And I will speak to you all next week. Have a wonderful rest of your Friday and your weekend, and I'll be in touch with you soon. Take care.